So we'll talk about the data that we do every week. The active cases as of September 20th are 363 now in Clay County. Previous week, they were at 291, so we're seeing still increases in our numbers. Active cases in Minnesota, we're also seeing increases from September 13th. It was 14,693, and now the 20th, we're at 18,124. And we also do the comparisons with what we're seeing in Cass County. They initially had some bigger increases in the previous weeks to this, but September 13th, they're at 527, and just reporting an additional case then on September 20th at 528. And the active cases, they were at 2,815, and now this week they're at 2,979. So a little less of an increase in North Dakota and in Cass County, but they had larger increases previous to this. And then we'll look at the active cases by age, which we've done each week as well. So interesting to note that, again, we're seeing it in the younger age groups. So the 10 to 14 is at 39, and then we're seeing the 25 to 29. But all of the age groups, we've seen an increase from 0 to 4, through the 30s. And previous to that, of course, was the elderly. But in this active cases currently, it is the younger populations that we're seeing the cases in. And then the cumulative cases by age, so total cases 9,267 to date. And there again, it just gives the cumulative ranges of cases, and the 20 to 24 at that 1,213. And then the cases per week, this is July through current, so we're seeing each week the number of cases, and it's only through 9/12 that we have the cases per week, so we're seeing that at 209. And then the cases per week throughout the entire, from March of 2020, and this is that ongoing graph where we're seeing the spike of cases and then spike in March again, and now some spikes in September. So then we'll go to the hospitalizations per week. So this just gives a range of the Clay County hospitalizations. So you can see previously where there's spikes in hospitalizations in November, and now we're seeing some increases in hospitalizations in August and September. And then hospitalizations by age groups. So the 5 that are hospitalized in the 60 to 64 range, and then we have 4 in the 65 to 69 range, and then 3 in the 80 to 84 range. So we're seeing the hospitalizations more in that age group. 3, of course, though, in the 20 to 24 and the 30s, and then the 40 to 44 as well. And North Dakota hospitalization data, so there's the number of statewide beds in North Dakota. Now, this is across the state, not just our hospitals on the Fargo side. And then you're seeing the numbers currently hospitalized due to COVID by age range. So you're seeing that at the bottom graph. The numbers that are being hospitalized, again, it's the 40s through the 80s. So those are the current hospitalization by age. 10.66% of the beds are available. So we're seeing still some high utilization of hospitalization beds and ICU beds. And then again, this is the graph from Sanford, and this just shows and across all of the Sanford-owned hospitals. So it's just showing again the patients with COVID, and in the red is the unvaccinated numbers that are hospitalized in ICU and on ventilators, and then the white figures are those that are vaccinated. So again, it's just we're sharing the information to show that it's really the majority of the unvaccinated that are being hospitalized in ICU and on vents. So the importance really, and this is a snapshot of just the Sanford hospitals, but it's really showing the importance of being vaccinated. And then,
Kathy?
oh, yes.
Early on, we talked a little bit about geographically where our cases were within the county. Are you seeing a fairly consistent spread over the entire county? I just noticed that this document hasn't been in for a few weeks, but are you seeing mainly in our Moorhead area, or is it fairly consistent throughout the whole county?
Yeah, in order to get that information, our case investigators have to go through the entire list of those that are positive. We don't have a graphic of that, but I can certainly have them try to vet out in per zip code area too, but it's not as easily accessible as it once was. So we can certainly try to get that information so you have a little bit more about that.
Thanks, Kathy.
Commissioner Ebinger.
Kathy, I'm not trying to be an alarmist, I'm just looking at the data, and I don't want to read too much into it. But if you look at same time last year with cases and hospitalization, we're actually a little bit ahead of it. The numbers are higher right now.
Correct.
Would it be unreasonable to project that this could give us a winter surge like we had last year that would be even greater?
That's the concern, particularly with the Delta variant that becomes much more infectious than the previous variant. So the concern is if we don't get a better response from vaccinations and we don't develop a better herd immunity, then the variant strains could even change even more, where they'd be more infectious and more concerning. So yes, we aren't out of the woods. In other words, we really want to get people vaccinated and still follow the guidance. So you're right, we could have a higher surge if we don't accomplish our goal of getting vaccinated. So, good question. Thank you. So, Jamie, do you want to talk about the vaccines?
So that brings us to the important issue of vaccination. So I'll talk about the vaccination data. So our total number of doses by Clay County Public Health alone, 15,535. Last week, we provided just 88 doses. The response to clinics is very minimal. However, there are so many opportunities in the community for vaccine as well. And what we've been doing is really, if we've got those stragglers that need a dose of Moderna and there's 13 doses in a bottle, rather than us opening up a bottle, we are connecting them with the pharmacies. They have walk-in opportunities for Moderna and Pfizer as well. Lots of opportunities in the community. But we continue to hold our clinics to get those numbers up and provide opportunities for the citizens of Clay County. Our real primary focus is on the most vulnerable populations, as always, in Clay County. So every week we're reaching out to the homeless shelters, to the high-rises that have a lot of people that don't have as many opportunities for transportation. So we are taking vaccine out into the community as much as we can to reach them. Looking at the statewide data, Kathy, if you want to go to that slide. We are statewide in Minnesota, the individuals with at least one dose of vaccine, we're at 71.7% now. And then those that have completed the vaccine series at 67.9% as of September 16th. And then we've got a breakdown there by the age group. So one dose for the 12 to 15-year-olds, we're at 53%, completed vaccine 47%. So that's significant progress. The 16 to 17%, 59% have had one dose, and 54% have completed the vaccine. And again, our 65 and over is what we have reached the highest percentage at 91% have one dose, and 89% have completed that vaccine series. Total population, 61% statewide in Minnesota have at least one dose, and 57% have completed the series. And then just to let you know what we are doing this week, we have a clinic at the Family Service Center. Just one clinic this week. We're short of staff, but continue to hire vaccinators to assist us. But we have a clinic on Thursday, September 23rd, 1:30 to 5:30. and that is open. We are expecting about 50 second doses, but open for first doses as well. We have Pfizer and Moderna available, and registration can happen on our website, or we also always have the QR code for them to come and register on site, so. And then, looking at the breakthrough cases, we continue to see breakthrough cases, but it's important to note that those are still very low percentage. The breakthrough cases in Minnesota, 0.749%, breakthrough hospitalizations, 0.04%, and breakthrough deaths still at 0.004%, so very low percentage of that for breakthrough. And that's about it.
So a couple things to note. There is still confusion about the booster vaccine, and then there's a third dose vaccine. So just to clarify the difference between the third dose and the booster dose, the third dose that's out there is for the immunosuppressed people that often are failing to reach the full level of immunity. So giving that third dose will hopefully boost those. And we talk about the immunosuppressed, what they have, what they're offering for that third dose are those that are really significantly immunosuppressed. So those examples of the health conditions would be if they're undergoing cancer treatments, if they've had a stem cell transplant, if they're on significant long-term medication for rheumatoid arthritis, for example, and if they're HIV positive. So it's very specific about those that are significantly immunosuppressed that qualify for that third dose. Now, we in public health are not offering that third dose because they really need to be vetted out by their medical provider. And determined if they meet the qualifications, because it can't just be anyone that gets a third dose. So we are not providing at this time, based on recommendations, of course, by Minnesota Department of Health. But the third dose is being offered at providers, and I think the pharmacies, if they have if they meet those qualifications. So it's very much those that are immunocompromised significantly. Now the booster doses, White House had announced quite some time ago that September 20th, booster doses would be out for all Americans, but the FDA and the CDC were not quite there yet, and we're scrambling. So the advisory committee did not recommend that all Americans qualify for the booster dose. So they just made that announcement. So anyone that needs a booster dose will not necessarily get it. However, they did agree that those 65 and older and those with significant health conditions would qualify for a booster dose. So more to come on that. That decision was made by the Executive Committee for Immunization. So they'll be talking about the booster doses for the 65 and older and those with some health conditions. So that should be, more information should be coming soon on that. Anything additional to that, Jamie, that you're aware of?
Sounds good.
And then the other announcement, Minnesota has now a mobile app, and that's to access the immunization records. There wasn't really a way to access that with their mobile app, so now they have something. And so they've just put this out. It's a docket app, and you can access it on your Android or Apple. It's free, and they've had so many requests for getting immunization records, and sometimes they need it in a timely manner. Parents that need it for their children's immunization records, and others that want it, particularly for COVID vaccine. So it is available now, and it's going to meet the consumer demand to access those immunization records. So it's available. It will be on our website as well, so to explain how to access that. And again, free and available, and it's going to be much more timely for people that want access to their immunization records.
And can I add to that?
Amy.
What we have been doing is printing those records or emailing a copy for anyone who asks. So the Minnesota mix system is what we typically use, and we're happy to do that. It's just that this is, if you can use the docket app on your phone and you have that, but otherwise, we're happy to help you as well.
Commissioner Ebinger.
Just yesterday, reading that in the paper, I put it on my phone. It took about 15 seconds. It's a piece of cake, and it gives you the Minnesota Department of Health PDF with all your immunizations. It's got mine on everything, every shot I've had since I moved to the state. So it's very thorough, and it's real user-friendly.
Speaking of shots, flu season is coming up, and I had mentioned that in the past, we've had shots here, kind of promoting the flu shot season, and I don't know what your timing is, but I'm looking at the 28th of September, the 14th of October, or the 12th of October, excuse me, as dates that would work here, I think. I know Commissioner Ebbing, oh, you've already had yours anyway, okay. Okay, so then it could be the 4th too, or the 2nd, the 4th, the 5th.
Sure.
28th, the 5th, or the 12th?
We
Do you
do
have
have
that
some
available?
flu shots.
We do have our vaccines, so we have to have the protocol from Minnesota Department of Health, and it has to be reviewed by our medical consultant. And so
Okay.
that might be a little bit early, but if we can't do that meeting, we could certainly do the
Okay.
next one.
Okay,
I did see that it looks like you start the middle of October administering for the general public, so I think that
Rural sites.
side.
yeah, maybe that around the 12th would work then, maybe. Well, whatever, as soon as you
That
get
should
your
work,
protocol,
sure.
that would be good, and we should
Absolutely.
just bring it forward.
That's great.
Anybody here who wants a shot in the arm that day can get one. All right, thank you.
Thank you very much.